Let's talk about breast implant revision and removal. Breast implants are not made to last forever. For this reason, after a certain amount of time, for a lot of people that could be 10 years, 15 years, a consideration needs to be made if it's time to either remove them permanently or remove them and have them replaced with a new set of implants. This is something that we can talk about with a consultation at Avabello. Any patient that has breast implants needs to always monitor them for changes that can be a sign that there's a problem. Implants can bottom out, meaning that they slide below the original pocket. They can also develop capsular contracture, which is scar tissue around the implant that can squeeze it and cause pain. If you're noticing changes in your breasts or something doesn't seem right, now's the time to come in for a consultation with a board-certified plastic surgeon to review your anatomy and answer any questions that you might have, as well as give you an opinion as how best to proceed. When breast implants are removed, there's normally a mismatch between the amount of skin and soft tissue present now that that volume is not there. A thorough breast implant removal consultation will also include a conversation regarding a breast lift. This can involve removing some of that excess skin and soft tissue in order to end up with a nice, perky, aesthetic appearing breast, even without an implant. Whenever I have a patient in for a breast implant removal consultation, one discussion that we always have is whether or not we're going to simply remove the implant and lift the breast, or whether we're also going to remove the implant and replace it with a new implant. This is a very personalized decision and it's different for every patient. But the main consideration is, do you want a new implant placed? When getting a new implant, what this is going to do is reset the clock. You're going to be starting from zero. You'll have a fresh set of implants, but 10 to 15 years down the line, some of these same questions are going to come up again. And you're going to have a second consultation or a second procedure done to either remove or replace the implants at that point down the line. Most of my patients that are having an implant replaced or an implant removed have less downtime and a quicker recovery than the first time around. There are safe, thoughtful options when implants no longer feel right.